Welcome back. We are continuing with psychiatric section and we have a subject brief psychotic disorder, which is related to the psychosis family, but this have a brief or short period of time. By definition, it is characterized by the existence of a brief psychotic symptoms lasting for at least 1 day and less than a month. And after that, people usually recover completely to the normal life. It usually uh, have a sudden onset, and full remission within 1 month is awaited. So from 1 day to 1 month duration is necessary to establish diagnosis. If this one have more than 1 month, it is related to another psychosis diagnosis. By classification, we have three types, as you see, without obvious stressor and postpartum related to the woman. So brief psychotic disorder with obvious stressor, or also known as brief reactive psychosis. This type happens shortly after trauma or a major stress such as death of a loved one, an accident, an assault, or a natural disaster. Of course, it should have substrate. Second one, brief psychotic disorder without obvious stressor or without any of the stress. With this type, there is no apparent trauma or stress that can trigger it. And the last one is brief psychotic disorder with postpartum onset. This type happens only in women, of course, and usually within 4 weeks of having a baby. Does exist any of the causes of brief psychotic reaction? Of course, of brief psychotic disorder. So genetic link, family history, mood disorder, stressor situations, major stress, traumatic events, of course, can be related to another diseases like systemic lupus erythematosus and steroids. And apparently statistics told us that this is a very rare disease and is encountered in young people like 20 to 30 years old, more common in women, and associated with people who have also antisocial or paranoid personality disorder. Symptoms for psychosis family are psychosis. Most common symptoms represent hallucinations and delusions. Hallucinations represent someone that might hear voices, see things that aren't there, or feel sensations on their skin, even so nothing is touching to their body. So there are many times like auditory, visual, and tactile, and so on. And delusions, these are false beliefs that someone refuses to give up, even if even in the face of the fact. So you are trying to convince the person about these false beliefs, and they do not exist, but without result, as beliefs of the patient are very strong. Also, disorganized speech or disorganized thinking, speech or language doesn't make sense, unusual or strange behavior, problems with memory, disorientation, confusion, changes in daily habits like eating or sleeping, increased energy level, usually if it is psychosis, and losing of the weight, and not being able to make decisions. Very important. How about treatment? Someone with a brief psychotic disorder will probably got medication, as you see here. Two types of medications, typical and atypical antipsychotics. Also psychotherapy, a type of counseling. Patients may need to be hospitalized for a period of time if their symptoms are severe, or if they might harm themselves or someone else who is close to them or living in vicinity. The earlier the treatment, the better the outcome, for sure. If patient have problem with sleeping, you can give some diazepam or lorazepam. Once again, supervision if need hospitalization, do that. Short-term obligatory short term with antipsychotics. You should choose from, not you but a doctor, from typical or atypical, which is newer or a new generation. Psychotherapy after, of course, any of the medication applied, and hospitalization. Hope this video is useful for you. If yes, please subscribe and follow this one. Have a great time, guys.